Every month, I'm looking at my bank account and my calendar, and I'm trying to figure out how I'm supposed to do all the things that specialists have told me that I need to do for my kids. And honestly, wondering, how do other parents do it? I can't be the only one managing a household of 6, managing expensive special needs, and doing it on one income, but technically making too much to qualify for assistance for most programs. But not so much that any of this feels easy when you add up all the extra expenses. So when I find a program that helps fill in some of that gap, I paid attention immediately. I'm Mary Ellen. I'm a homeschool mom in Georgia raising neurodivergent kids, and I share real-life Georgia resource content for families like ours. Family Support Services is a Georgia program that can cover things like nutritional supplements, community memberships, swim lessons, respite care, expenses that are real and necessary, but often fall within the gaps because medical insurance often doesn't cover them. I applied for both of my boys that qualify for the Katie Beckett Deeming waiver for Medicaid. 2 weeks after I submitted, I was approved. This video is a step-by-step walkthrough through the application, how I filled out each section, what to write, what to attach, and what I wish someone had told me when I first started. If you haven't watched my experience video yet, then that will be in the description below. It covers what Family Support Services is, who qualifies, what funding looks like, and what the approval process felt like for our family. I do want to make one note before we get started. We live in Region 2, because we are in Columbia County. Your community provider experience may look different if you're in a different area. And the cover letter and some of the intake forms will look slightly different, but the main application will be the same because that's statewide. If you're not sure how to find your local provider, the experience video will show you how to do that. So now I'm going to share my screen and let's get started. So this is the cover letter I received at the beginning of the packet. You'll notice that the contact information and the logo is blurred for this. Anyway, so when your provider sends you the packet, it's going to be roughly 28 pages, at least for Region 2. I returned it all at once, completed and signed, along with my supporting documents. The coordinator seemed a little surprised at how thorough I was with the application. So I don't know if this is what everyone does, but this is what I did because it says to return the whole packet. So I completed everything that I thought was for me. So the packet has 2 main parts. The one is the IFSP annual review. This is the first, and it's the most substantive part. It's where you describe your child, their needs, and what services and goods you're requesting. The DBHDD application, this is the state eligibility application that everyone gets throughout the state. It's 4 pages, 5 sections, demographic information, diagnosis, current services, service requests, and your signature. The rest of this packet is standard consent and rights paperwork from your provider. But I'll show you every page so you know what to do every step of the way. So here's some things that you're going to be wanting to gather, and these can help you with the application. You're going to want diagnosis documentation, your child's social security number, and their Medicaid number and card if that applies to your family. The website says you do not have to have Medicaid, but we did, so we did supply that information. You need copies of your birth certificate. You need a recent photo, and if you have an SSA letter, they would want you to supply that as well. We did not, so that wasn't something we needed. Proof that your kid is diagnosed with an intellectual or developmental disorder. So for my son, I had submitted a diagnosis list and then also his most recent psychological eval. I submitted prescription lists from the doctors for the supplements that I would want to have covered, and also an order for supplemental shakes because those were some of my goals to prove that it was a medical necessity that we needed these drinks. They will cover them up to a certain amount if you're unable to get your insurance to cover them. And then if you have any other professional documentation that proves their diagnosis or proves that they need certain things, include that as well. If you do this when you first start the application, this will give you a little bit of time. This is probably what took me the longest, was trying to get the prescriptions from the doctors. This is the first page of the IFSP annual review. This is where you're going to be describing your child in context, explain what your family needs are, and lay out the specific goods and services that you have and what you would like to be receiving. This is the most important piece of your packet, and this is what you're going to be using to make your case that you should get funding. So this top section, you're going to fill in your child's name. I never filled in anything for the CID, the kid's date of birth. I put my name.
address, county, for me it was Columbia County, and then phone number. Okay, for this next section for eligibility, you're going to check off all 3 of these boxes. If these do not apply to you, then you're not going to be eligible. This is that your child has a developmental disability diagnosis, and you're going to write the diagnosis here. If they have more than one, you can write the first diagnosis and then say see attached for full list. Like for instance, one of my kids has autism, but he also has Klinefelter syndrome, which causes a lot of additional issues. So I include that as part of it. They reside inside our family unit, which is our home, and they reside in a county that is eligible for this program. And I want to show you 2 examples of what you can supplement your application with for diagnosis lists. This is the diagnosis list that I use for the Katie Beckett deeming waiver, and it's just the diagnosis and the ICD-10 codes. So you could do something like this. For this one, I kind of did more of a narrative. So I showed like primary developmental disability diagnoses, and I still have the ICD-10 codes. And then I have other co-occurring medical and genetic, and these kind of help me with my case. And then here's the neurodevelopmental and learning diagnoses. So I added a lot of information for them to get a good picture of why my kid should qualify. Okay, now we are down to this section right here. Just the tip before we get started, do this section by hand. They like the information directly on this form. So for my first son, I did it this way, and it looked very cramped, and it was kind of visually overstimulating for me. So when I did my second son's application, I typed it and then added it as a supplemental documentation and said see attached. They did not like that, and they asked me to redo it. So to save yourself some time, just write it all in. Okay, so the first question is person-centered description. This is asking, who is your child? What are their diagnoses? How do these diagnoses affect daily life? How they learn, what they struggle with, and what they're good at. Like, who is this person if they're just meeting them? There's not a lot of space here. I used as much space as I could because this is a pretty broad question with a little bit of space. Do your best. Second question is, what is important to you? They are talking to the child. What is important to your child? If your child is there and can answer, you can ask them what is important. Or knowing your child, as I'm sure you do, you can put in what is important to them. And so you can put their favorite subjects in schools, their hobbies, their extracurricular activities, their topics of interest, what's important to them about their peer groups and the community and how they're interacting. They want to get to know what's important to the child. So then the third question is, what is important for you? They are still talking to your child, and they want to know what is important for the child. And so some of the things that you could add in there are consistent routines. A lot of neurodivergent kids like consistent routines. Or therapeutic support. Does that help them with coping skills? Access to specialized nutrition and medical supplies, because that's something that we needed. That's important for my kid to thrive. Opportunities for social participation and skill building and family relationships, because sometimes these diagnoses are hard and having support can help these family relationships. Okay, now to family. Describe the family dynamics. They want to know the general stuff. Who's living in the home, who's the primary care provider in the home, what your family structure kind of looks like, and what your family's approach to care kind of looks like. For 5, what is your support network? If you literally have no one involved in your life, you could put no support network, but hopefully you're going to have some, even if it feels like you don't. So what formal and informal supports does your family have? Like therapies, providers, church, extended family, friends, all those things can be added in there to show a picture of what your support network looks like right now. And again, there's no wrong answers for these. This is going to be individual to your family. And then physical environment. Describe where your child lives and participates in the community. Are they at home? Are they homeschooled? Do they go to a public school? Are they in therapy appointments? The church, the community, anywhere, any location that they're going, add those for physical environment. Okay, and then number 6, this is current services. You're going to write in this box, see attached, and then you're going to provide a detailed table, which I'll show on the next slide. So I combined the lists for both of my kids for you to get a more comprehensive idea of some of the things that you can add to your services table. So What you're going to do is you're going to have the service, the waiver, the form, or the program, whatever that provides a service. So I have HIP, we get the health insurance premium payment. We have all the therapies, ABA, speech, occupational, physical therapy, counseling, and then specialists like the primary care provider, psychiatrist, neuropsychologist, neurologist, endocrinologist, ENT, allergy, immunology, functional medicine. And then we have like dietitian, genetics evaluation, dentist, orthodontist, ophthalmologist, dyslexia tutor, all the things that you can think of that support caring for your kid. And so then you're going to put the funding source. How do you pay for all these things? So to get the health insurance repay back, we have HIP and Katie Beckett Medicaid, because without the Medicaid, we would not be getting the HIP. So they kind of go together. And then I have a description on the other side, and I say that it's employer-sponsored health insurance premium reimbursement. So they know what kind of program this is, what it's providing for us. And then I have all of these therapies all the way going down here. This is all by my primary insurance as my primary, and I have KB for Katie Beckett as secondary insurance, and for all my copays. So that's going to be all down here until you get here. On the description side, I have how often they get these services and often a diagnosis or why they're getting them. And so most of it is some kind of insurance paying it, but we do have some out-of-pocket stuff, like we pay out-of-pocket for the dyslexia tutoring. Okay, and now I want to go backwards for a second to answer the last question, number 7. So number 7 is the unmet needs. You can say see attached because they give you like no room. So this is what your child needs that isn't currently being covered by any other programs. And now the second page of the annual review, we have the goods table that I'm going to have on the next slide. And then I just want to go over the signature section really quick before we move on. So I put yes that I'm signing the agreement. And I put yes that we agree with the IFSP. And then I signed here and dated. And then coming back up here, for this section, I combined these two questions about the summary of outcomes and the individualized services and goods and put it all on one table to give them that information. And here's an example of one of the tables that I created for one of my kids' applications. You're going to put the service good, the description or justification. You're going to answer the question, is this available through any other funding, frequency or for how long that you want this, and then the annual cost that you calculate. So for this, I have nutritional supplements, and I have the reason, and then I have YMCA family membership, and I have swim lessons with the member rate from the Y, oral nutritional shakes, and then I have jujitsu also, and then I have the total of this stuff, which was well over what I know they give per family. I put it down anyway just for them to see what the cost of those things would be. And obviously I know that I'm only going to get what's allotted. But down here, I did do a little bit of breakdown so they could understand why I was saying that my supplements were that amount. Okay. Part 2, the DBHDD application. This is the application that goes to everyone statewide. Okay, here's a more close-up view of page 1 of the application. You're going to write your date, the child's name, social security number, what their gender is, date of birth, age. You can put the race, it's optional. You can put their ethnicity, optional. You're going to put your private insurance information and your public insurance information. Public would be like Medicaid. You're going to put your name because you're the family member or guardian. And then here you have a relationship to individual. I put that I am the parent of a minor child. And then I put our address here, our county, phone number, email. So this is the same page 1, but here's the bottom section that I blew up so it's easier to see. And then here's the diagnostic information, section 2 section. You're going to check all of the applicable diagnosis categories that apply for your child. For us, that would be autism spectrum disorder. And then I checked other and put the other diagnoses that I felt also fell into the category of intellectual disability or neurodevelopmental disability. And I just wrote see attached. You already have that supplemental information from the previous form that you're attaching. And then you're going to put the age at time of diagnosis. So for my first son, he was diagnosed. My second son was diagnosed at 4, so I would have put 4 for him, and my other son was diagnosed at 10, so I would have put 10 for him. Supporting documentation. This is required, and I mentioned these things earlier. You need to attach the proof that they have these diagnoses. What specialist has done an evaluation and has diagnosed them with this condition? And so you can see here that you can do a psychological evaluation, an IEP, or other ones that show this information. So for me, I checked off psychological evaluation and checked off other, and I put my clinical summary for the failure to thrive diagnosis. And then for one of my sons, I put lab work that was showing proof of a diagnosis. And so it's going to look different for each family depending on what the diagnosis is and what else is going on with your kid. Okay, for this section right here for current services information, you're going to check off all that apply for you. For us, we have the Katie Beckett deeming waiver, so I checked off there. If you're getting food stamps or if you have an IEP, those are all good options for things to check off. If you don't know the abbreviation, there's a good chance that you're not getting that service, so skip it. And if you were almost done with an application, you could put a note saying pending if you wanted to give that information. And then please check all sources of individuals' current natural support network. So this will probably be what you put in that other application earlier about support network, like family, friends, church, social groups, co-workers, and support group. I think I checked off family, friends, and church for us. Okay, so now let's go down to this next section here. I blew it up a little for you so it's easier to see. You're going to check in the boxes if you would like these services. So some of the things that I checked off were respite care, specialized clothing because I have a kid that needs AFO socks, specialized equipment, assistive technology, therapeutic services, counseling, parent-family training, specialized nutrition, behavioral consultation, and support. Am I going to get all these services this first application? No, I am not. It's going to be well over the limit that they have you capped out at. I just want it documented, all the things that our family could potentially need for in the future. And then it asks if any of the services that you checked off, if you can get them through other sources. And I checked no, I cannot. Family support services is a last resort payer, so you want to make sure that you can't get these things somewhere else. Also, it's asking if you've been denied for any of these things, and so that's just going to be your personal experience. I put no because I had never formally done a request. Okay, describe the benefit to the family if the services and goods above were funded. How would these goods and services affect your family? What is the benefit to you? Why do you want this? So some questions you can ask yourself would be, would they prevent burnout for caregivers? Just a side note, respite care, they do have separate funding for you outside of the cap for the overall services. They do have a separate funding pot for that. Do you need adaptive clothing like AFO socks? Could this funding provide a safer living environment? Could it provide more opportunities for socializing and engaging with peers? How is it going to help your family? On page 3, read your agreement prior to signing, and then if your child is under 18, then you're going to sign on this third line here, parent or legal guardian signature, date, and then you're printing your name. This is page 4 of the application. This you skip entirely. This is for your provider and the reviewers. Now, the rest of this stuff is specific to my provider and their intake paperwork. So if you're in region 2, this is going to look the same. If you're in another region, probably going to be seeing similar forms. This is your family support service agreement. I did not put the agreement start date because I did not know when it was going to start. Your coordinator can do that. I did check off initial review because it was our first time. And then I put my kids' printed name, their date of birth, their social security number, their address. I put my phone number because my kid does not have a phone. And then I put my name because I'm applying on behalf of my child. And I put mother because that is my relationship. And then you have family member's address, same as above, and then family's phone number. You can just do check if same as individual. The rest of this is already filled out by the provider. Okay, this is page 2 of the family support service agreement. This has a whole bunch of statements that you need to read carefully and then initial on each line saying that you've read it and agree. Page 3 is more of that. Read, initial, and move on. Page 4, read, and then the signature section. Your child can print and date, and then you're going to print your name here and date. These 2 lines for the coordinator. Okay, individual data information sheet. Child's name, their full name, last name, first name, middle initial, street address, city, state, zip, phone number. I put it here because this is my phone number and it's a cell. Their social security number, date of birth, their gender, and race. Marital status, I put single, my kids are minors. Employment status, I put an A, and education level, I put what grade they're in. Okay, source of referral, I put self-referred/family. For personal legal information, I put, for a legal representative, I put my name. I put mother/legal guardian. I put my address, my phone number. Do you have proof of power of attorney or guardianship with you? I put no, I don't have that since I'm the biological mom. This is for people with power of attorney or other types of custody documentation. Emergency contact, I put my husband, his name, father, his address, his phone number, his address, which was the same as ours, and his phone number. Communication information, it's asking how they can communicate. I put yes to all these, and I wrote my email address. And then for 1 through 3, it's asking if you have another address or phone number where you want the information sent, and to put that information if you do. If the answer is no, then you're just going to leave all the rest of this section blank because it doesn't apply to you. And then it has individual signature here. This is where I signed and dated. And page 2 of the data information sheet, I put his name, his allergies, his diagnosis. I put his top 2, and then I put see attached for full list. I put the primary care provider's name, the clinic's address, and their phone number. And then they want the dentist's name, address, and phone number. There, I had no extra directions, so I ignored that. Financial information. I looked at our monthly gross income that were on my husband's pay stubs and wrote that total amount here, the number of dependents, which is 4 because we have 4 children in our family. Source of family income. Work income is our only source of income. You would obviously put whatever is true for your family, and then I wrote the same amount as here, and then I left this area blank. Medication profile. This is the form that comes in the application. You have 2 options for completing this form, and I did both of them depending on my child. Now, I have one child that has a ton of medications and supplements. There were not enough lines on here, even though they provide quite a few, to fill out this form. So I just wrote see attached, and then with the supplemental documentation, I included their medication list. So I made pretty much the same thing here. Their medication, the dosing, the route, the frequency, the instructions for when I gave it, who prescribed it. I put the actual doctor's names, but this gives you an idea of how this chart would look. And the reason, so pretty much the reason or diagnosis for all these things. But then for my other son, he gets 2 medications. And so for him, I wrote his name at the top, which you would do for both of them. And then if I knew the date of when he started them, I put it, or I put the year, if I knew like the year it started. So his 2 medications were melatonin and a sleep aid. So for the melatonin, I put the year he was 4 because that's as far back as I could remember. And then I put the name of the medication, how much, orally, so you can do PO for oral, and then at bedtime. And then I put the PCP's name, or the primary care provider, and then put yes. And then for the prescription, I did the date it was prescribed because it was recent, so I knew it. The name of the medication, the dose, the route, all the same stuff. And then I put an arrow for both of them and put assist with sleep, side effects, I put drowsiness, and then adverse drug reactions, I put no, and that was it. Individual is compliant with prescribed medication. I checked yes. And you would check this off even if you say see attached. Individual has been informed of the availability of of the patient assistance program? And I put no, because I don't know what that is, but all of our prescribed medications are covered by our insurance and Medicaid, but I have not been able to find any assistance that helps with supplements until this program. I put my son's name, date, left the rest of this blank for the provider to fill out. And for this page, I did nothing to it. This is notice of privacy practices. This is page 1. I wrote my child's name at the top and I read it. And then I finished reading and I signed and I dated. So this is verification of lawful presence in the U.S. They want to make sure you're a U.S. citizen before giving you these services, because that's who qualifies. So I put my son's name at the top. It has different ways you can show evidence. They request your birth certificate and your social security number as part of the packet, which qualifies you for this stuff. So you're just putting your kid's name here. And on the second page, you're doing the same, putting your kid's name again. And then this is individual served rights and responsibilities. So it's letting you know your rights. You're going to want to read this to make sure you know all your rights within their system. You're going to write your child's name at the top. Write their name at the top again. Continue reading. This is for your child, individual served signature and date. And then if they're a minor, you're signing here, guardian, representative signature, and the date. Consent for photograph. You're going to write your kid's name at the top again, and you're going to check off what you feel comfortable with. For me, I said that I was okay with them using it in the clinic and for the electronic record, but otherwise I didn't want them to have consent for photograph. But you're going to put whatever you feel comfortable with, and then I signed and I dated. And then consent for treatment, you're going to put the kid's name here. You're going to read the information. You're going to sign here, and you're going to date. If your kid was over 18, they'd be signing here. This is blank. This is if you decide to withdraw consent for treatment, then you would fill this out and submit it. This is authorization for release of information. So for this, I made photocopies of it for the amount of providers that I wanted them to have access to. And so the providers that I filled this out for were ones that had documentation that I'm submitting that show proof of their diagnosis or their needs. For one of my kids, I put his neuropsychologist because that's where the psych eval came from. I put his primary care provider because that's where I had the failure to thrive clinical note and also the order for the nutritional shakes. And then I also had one for my son's functional medicine doctor because she was the one that wrote the prescription for all of the supplements that I wanted reimbursed. So I put my kid's name, their date of birth, the name of the provider and the clinic that they belong to, and their address. I initial. For these, it asks for the time period. So we had only moved here a couple of years ago, so I put 2024 to present. They're welcome to that information from that time period. And then here, the above information is for the purpose of. Your provider is just getting this random facts asking for information. So this gives them a little bit of context for why this provider is asking for this information. So I put to support family support services application and an individualized family support development plan. They already have checked off that this is good for 1 year. And then I signed here. I wrote my relationship as mother and I wrote the date that I signed it. They have this My Human Rights picture document to look over. I wrote my child's name and the date on page 1. There was nothing to do on page 2. So this is the satisfaction survey. I'm sure this is mostly useful for the renewal process, but I did fill it out. And I checked off that I'm the parent or family member of the individual. And I put that I'm female and I put my age. And then for these, this is going to be very personal for what your experience was with this provider. 4 down, I just put NA, initial application. And I just put that for all of those. And then for a family support services provider, I put the local provider that I'm filling out the forms for. And so here's a reminder of the things you might want to include in your application as you're going through it. You're going to make sure you complete all the application forms and sign and date everything. You're going to attach all required documents and copies that it's requested for you throughout the application. So that's the front and back of insurance cards, prescriptions or orders, documents proving diagnoses and needs like a psych eval, clinic notes, lab reports, supplemental documents created for the application. So if you wrote see attached for everything, make sure it's actually attached. Include birth certificate and social security card copies. Provide a recent photo for the file and add the SSA letter if applicable. It wasn't for us. And if you would like more Georgia resource videos, you can check that in the description below. Here's my contact information for my business. So So after you have all of this put together, you're going to want to scan all of this information in so you have a digital copy of it. And then if you had anything that was already digital, you can just leave that there. And what you're going to do is you're going to send this application to the email that they sent you the application through. So for my application, it was a little large, and so it couldn't fully send as one piece. So I did end up having to split my application into 2 sections. And then I sent 2 emails explaining that I was sending 2 emails with one part of the application in one email, the other part in the other end. And then I tried to get all the supplemental forms in the 2 emails too, and I was able to do that. And then after that, if you haven't heard from them within a week, I would send out another email asking for confirmation for receipt, just to make sure, because you never know with emails if it's going to go through or not. And then once you submit the application and they receive it, if they have any questions, they'll call you to clarify anything, and then they'll submit it to whoever the reviewer is. And then it only took 2 weeks for us to get our approval back. So it was pretty fast. And then it was another 2 weeks before me and the coordinator could coordinate our schedules together to do the intake interview. So that's the full packet. If you have any questions, you can leave them in the comments. Hopefully I can answer them. And as I figure out more with this program, I'll share those videos as well to keep you in the loop with what I figure out. And some links that will be in the description, the experience video, regional map for finding your provider, constituent services if you get stuck, and the full Georgia resource playlist. And I'm Mary Ellen Yates, and this is Growing Together, Neurodiversity at Home. I'll see you in the next one.